Good morning, students. Today we are going to discuss about the cataract. Cataract is an opacity of the lens. That is, opacification of the lens is called a cataract. The transparency of the lens may be disturbed due to degenerative process leading to opacification of the lens fibers. A cataract is a opacity of the lens. Cataract, cataract that is derived from a Latin word that is cataracta, that means waterfalls. It is the leading cause of blindness. In this, the age-related cataract is responsible for around 48% of world blindness. It is also an important cause of low vision in the world. Cataract is an important cause of low vision in the world. Next is the pathophysiology of the cataract. It can develop in one or both eyes at any age for a variety of causes. The cataract can develop one or both eyes at any age for a variety of causes. Any physical or chemical cause may disturb the intracellular and extracellular equilibrium of the water and electrolyte. That rearrange the colloid system in the lens fibers and that lead to epithelial cell necrosis and focal opacification of the lens epithelium. And finally, the opacification of the lens occurs. That is, any physical or chemical causes that may disturb the intracellular and extracellular equilibrium of water and electrolytes. That rearrange the colloid system in the lens fibers that leads to epithelial cell necrosis and focal opacification of the lens epithelium, and finally the opacification of the lens occurs. That's all about the pathophysiology. The causes of the cataract are old age, ocular and systemic diseases, that is mainly diabetic mellitus, uveitis, any previous ocular surgeries, etc. And systemic medications like steroids, trauma or intraocular foreign bodies, ionizing radiations like X-rays and UV ultraviolet rays. And the other factors are the congenital and inherited factors. That means abnormal galactose metabolism, hypoglycemia, then myotonic dystrophy, Marfan syndrome, rubella, high myopia, etc. These are the congenital and inherited factors. That's all about the causes of the cataract. That is old age, ocular or systemic diseases, systemic medications, trauma or intraocular foreign bodies, ionizing radiations, congenital and inherited factors. The risk factors are the increasing age, diabetic mellitus, excessive exposure to sunlight, smoking, obesity, high blood pressure, previous eye injury or inflammation, previous eye surgeries, then prolonged use of corticosteroids, drinking excessive amount of the alcohol. These all are the main risk factors of the cataract. The next one is the symptoms or clinical features. The main clinical features are progressive decrease in visual acuity for near and distant, glare in bright light and sunlight, then uniocular diplopia, fixed dark spot in the field of vision, sclerosis, and the other features are clouded or blurred or dim vision, increasing difficulty with the vision at night, then sensitivity to light and glare, need for bright light for reading and other activities, seeing halos around lights, frequent changes in eyeglasses or contact lens prescription, then a fading or a yellowing of colors, double vision in a single eye. These are the main clinical features of cataract. There is the blurred vision, cleared view, then changes in color, etc. The next is the diagnostic evaluation. The first one is the history collection. From history collection, we have to collect the any history of ocular or systemic diseases like diabetic mellitus, uveitis, etc., or any previous ocular surgeries, systemic medication, use of systemic medications like steroids, then assess the age of the patients, and other factors may causes, that is like trauma or intraocular foreign bodies, exposure to ionizing radiations like X-ray, UV rays, etc. So we have to collect the detailed history of the patients. The next is the visual acuity test. Then eye examination by dilation of the eyes. Then tonometry. Tonometry means it is used to determine the intraocular pressure. That is the fluid pressure inside the eyes. The tonometry is mainly used for assess the intraocular pressure of the eyes. The next is the classification of the cataract. The cataract is mainly classified according to morphology, then based on the age of onset, then depending on the maturity. It is mainly classified, the morphological classification, that is mainly two types, that is capsular and subcapsular cataract. The capsular cataract means the opacification or opacity of the capsule of the lens. In capsular cataract, the opacification occurs in the capsule of the lens. And in subcapsular cataract, it usually forms near the back of the lens. The subcapsular cataract, that is, forms near the back of the lens. That is the light, that is the right in the path of the light. It often interferes with our reading vision, that reduces our vision in bright light and cause glare around light at night. That's all about the subcapsular cataract, that is usually forms near the back of the lens. And according to the age of onset, it may be classified into congenital and senile cataract. The senile cataract is an age-related cataract. Senile is an age-related cataract. The vision impairing disease characterized by the gradual progressive clouding and the thickening of the lens of the eye. It is an age-related cataract. It is the most common type of the cataract. The most common type of the senile cataract are defined by the location in the lens. That is, according to the location of the lens, the senile cataract are divided into mainly three types. That is, nuclear, cortical, and posterior subcapsular cataract. The nuclear cataract means it is associated with the myopia, that is, which worsen when the cataract progresses. And it progresses, which worsen when the cataract progresses. That is a nuclear cataract, that is, it is associated with the myopia, that is the central opacity in the lens. Then second one is the cortical. Cortical cataract means the opacity in the cortex of the lens. In cortical cataract, the opacification occurs in the cortex of the lens. It involves anterior, posterior, or equatorial cortex of the lens. A cataract in the equator or periphery of the cortex does not interfere with the passage of the light through the center of the lens and has a little effect on vision. The cortical cataract progresses at a highly variable rate. That is, vision is versus in very bright light. That is about the cortical cataract. And the third one is the posterior subcapsular cataract. Posterior subcapsular cataract that occurs in front of the posterior capsular. In posterior subcapsular cataract that occurs in front of the posterior capsule. This type typically develop in younger people. It is commonly seen in younger people and in some cases is associated with prolonged corticosteroid use, inflammation or trauma, etc. These are the main causes. It is usually seen in younger peoples, and also it is seen in, or it is associated with prolonged corticosteroid use, inflammation or trauma. And in this, the near vision is diminished and the eye is increasingly sensitive to glare from the bright light. That's a posterior subcapsular cataract. And depending on the maturity, the cataract divided into immature and mature. In mature cataract, the lens is completely opaque. In mature cataract, the lens is completely opaque and the vision reduced to just a perception of the light. And in this mature cataract, the lens appears pearly white. And in immature cataract, it is an incomplete cataract. The lens is only slightly opaque and the cortex is clear. In the immature cataract, the lens is slightly opaque and the cortex is clear. That is the immature cataract. And the one more type, that is the hypermature cataract. In hypermature cataract, the anterior capsule is shrunken and wrinkled due to the leakage of the water out of the lens. In hypermature cataract, the anterior capsule is shrunken and wrinkled due to the leakage of the water out of the lens. And this is two type. That is the Morganian or liquefactive and the sclerotic cataract. The sclerotic cataract is usually developed older pupil, and these changes are the part of the aging process of the eyes. The hypermature cataract, it is mainly two types, that is the Morganian or the liquefactive and the sclerotic cataract. And the another classification, that is depending on the etiology. And depending on the etiology, it is divided into traumatic, that is in traumatic, the penetrating injuries, blunt injuries, infrared radiation, ionizing radiation. Then congenital and developmental, that include hereditary, maternal, prenatal infections, then maternal drug injection, inborn errors of the metabolism. And the next one is the presenile cataract, that is mainly dystrophia myotonica. That is a cause. Dystrophia myotonica means that is a long-term genetic disorder that affect muscle functions. It is a type of the muscular dystrophy. Dystrophia myotonica is a type of the muscular dystrophy. It is a cause, presenile cause. Then atopic dermatitis. These are the main presenile causes. The next one is the toxic, that is corticosteroids, uses of the corticosteroid. Then certain drugs like corticosteroid, mitotics, etc. Then secondary, that is complicated anterior uveitis. Then high myopia, then chronic vitreoretinal disorders. These are the secondary factors. Then other classification is the metabolic, that is diabetic causes, that is the diabetic mellitus, galactosemia, then hypocalcemia, Wilson's disease, etc. Then next one is the treatment of the cataract. It is mainly, it is treated by the glasses, by using glasses. That is cataract alters the refractive power of the natural lenses. So glasses may allow good vision to be maintained. നമ്മുടെ ലെൻസിൻ്റെ പവറിനാണ് ചേഞ്ചസ് വരുന്നത്. അപ്പോൾ അതുകൊണ്ട് നമ്മൾ ആ ഒരു നല്ല ഗുഡ് വിഷന് വേണ്ടിയിട്ട് നമ്മൾ സാധാരണ ഗ്ലാസ്സസ് യൂസ് ചെയ്യാറുണ്ട്. ദെൻ അതുപോലെ സർജിക്കൽ റിമൂവർ ഉണ്ട്. സർജിക്കൽ റിമൂവർ എന്ന് പറഞ്ഞാൽ വെൻ വിഷ്വൽ അക്യൂറ്റി കനോട്ട് ബി ഇംപ്രൂവ്ഡ് വിത്ത് ഗ്ലാസ്സസ്. ഗ്ലാസ്സസ് വെച്ചിട്ട് നമുക്ക് ആ ഒരു വിഷ്വൽ അക്യൂറ്റി മെയിൻറ്റെയിൻ ചെയ്യാൻ പറ്റുന്നില്ലെങ്കിലാണ് നെക്സ്റ്റ് മെത്തേഡ് സർജിക്കൽ മെത്തേഡിലേക്ക് നമ്മൾ പോകുന്നത്. സർജിക്കൽ ടെക്നിക്സ്, ഡിഫറെൻറ്റ് ടൈപ്സ് ഓഫ് സർജിക്കൽ ടെക്നിക്സ് ഉണ്ട്. ദറ്റ് ഈസ് phacoemulsifications method, extracapsular cataract extraction, intracapsular cataract extraction, intraocular lens implantation, and the cryosurgery. These are the main surgical methods of the cataract. In phocoemulsifications means in this surgery, an ultrasonic device that liquefies the nucleus and cortex, which are then sections out through the tube. That is, in the phocoemulsification, the ultrasonic device that liquefies the nucleus and cortex, which are then sections out through the tube. The posterior capsule is left intact. The incision is very smaller than the extracapsular cataract extraction, and the wound heals more rapidly, and there is early stabilization of the refractive errors and the less astigmatism. And second one is the intracapsular cataract extraction. In this, the entire lens, that is nucleus, cortex, and capsule is removed, and fine sutures close the incision. In intracapsular cataract extraction, the entire lens, that is nucleus, cortex, and capsules are removed, and fine sutures close the incision. And it is infrequently performed today. And next one is the extracapsular cataract extraction. It achieves the intactness of the smaller incisional wound, that is less trauma to the eyes, and maintains the posterior capsule of the lens and reducing the postoperative complications. In this method, the portion of the anterior capsule is removed and allowing the extraction of the lens, nucleus, and cortex. The posterior capsule and the posterior capsule support and left intact, and after the pupils has been dilated, the surgeon made a small incision on the upper edge of the cornea. Then a viscoelastic substance or a clear gel is injected into the space between the cornea and the lens, and this prevents the space from collapsing and facilitate insertion of the intraocular lens. That is, in this method, that is extracapsular cataract extraction. In this method, the portion of the anterior capsule is removed and allowing extraction of the lens, nucleus, and the cortex. The posterior capsule and the capsule are left intact. After the pupil has been dilated, the surgeon made a small incision on the upper edge of the cornea, and a viscoelastic substance or a clear gel is injected into the space between the cornea and the lens, and this prevents the space from collapsing and facilitate insertion of the intraocular lens. That's all about the extracapsular extraction. And the main complication are infective endophthalmitis. That is a condition in which the internal structures of the eye are invaded by the replicating microorganism, that is resulting in an inflammatory response that ultimately may involve all tissues of the eyes. That is the infective endophthalmitis, that is inflammation. And the suprachoroidal hemorrhage, that is an accumulation of the blood within the potential space between the choroid and the sclera. That is the suprachoroidal hemorrhage. Accumulation of the blood within the potential space between the choroid and the sclera. And the vitreous loss. Vitreous loss means it is a prolapse or anterior displacement of the vitreous gel into the anterior chamber beyond the plane of the posterior capsule. That is a vitreous loss. And other complications are the uveitis, ocular perforation, then postoperative refractive errors, posterior capsular rupture, etc. These are the main complications of the cataract surgery. And the preventive measures are protect the eyes from UVB rays, that is by wearing sunglasses and have a regular eye examination. Then stop smoking, eat fruits and vegetables that contains antioxidants, then maintaining a healthy weight and keep diabetes and other medical conditions in check. And the nursing diagnosis are the anxiety related to lack of knowledge about the postoperative care, then risk for infection related to surgical incision and self-care after surgery, risk for injury related to sensory deficit while operated, eyes is patched. These are the main nursing diagnoses. So that's all about the cataract. So cataract is the opacification of the lens. And the main causes are the old age, ocular or systemic diseases like diabetic mellitus, uveitis, then systemic medications like steroids, trauma, intraocular foreign bodies, ionizing radiations, congenital and inherited factors. Then risk factors: increasing age, diabetic mellitus, excessive exposure to sunlight, smoking, obesity, high blood pressure. Then previous eye injuries, previous eye surgeries, prolonged use of corticosteroid, and drinking excessive amount of the alcohol, etc. And the clinical features mainly the blurred vision, then progressive decrease in visual acuity, uniocular diplopia, fixed dark spot in the field of vision, etc. Then diagnostic measures mainly history collection, visual acuity test, dilated eye examination and tonometry. And classification mainly morphological, age of onset and maturity. In morphological classification mainly two types, capsular and subcapsular cataract, and age of onset, that is mainly congenital and senile cataract. In senile cataract it is mainly three types, that is the nuclear, cortical and posterior, subcapsular, and depending on the maturity, this is mature and immature, and also the hypermature cataract. And depending upon the etiological factors, it is mainly divided into traumatic, then congenital, developmental, toxic, secondary, metabolic, etc. And finally the treatment, that is mainly by using glasses, and when the visual acuities cannot be improved with the glasses, the surgical methods are used. That is the main surgical techniques are the phacoemulsifications method, extracapsular cataract extraction, intracapsular cataract extraction, intraocular lens implantation, and the cryosurgery. So that's all about the cataract. Thank you.